Hi, this is Professor Schleich here, and I want to welcome you to a a recorded review of the official guidelines for chapters 1, 2, 3, and 4 of the coding manual. I'm going to start out by reviewing these 4 chapters, giving you some examples to follow. We're going to work through the index, into the tabular, and apply the official guidelines. So what we're looking at today, we're going to start with Chapter 1, Certain Infectious and Parasitic Diseases, and I want you to open up your coding manual to A00B99. So those are the codes we'll be discussing. I'm going to review the PowerPoint, but you can keep your coding manual open as we move through these. So I won't stop on each one of these, the PowerPoint. I'll breeze through those, but it will give you a general idea. The focus of this is to show you how important it is that the official coding guidelines drive the coding or drive the diagnosis. So you need to know where they're at and how to apply them. And what I'm looking at is actually coding the diagnosis, walking you through it to the very end and getting you to apply at least one of the guidelines. So again, I'll review the PowerPoints, but I will not, I won't dwell on those. They are available for you out underneath the AHEMA website, or if you have a classroom or a textbook, this is what you're going to be using for the coding guidelines and to code. So let's get started. Chapter 4 is infectious, certain infectious and parasitic diseases, and obviously, we just talked about the official guidelines. So the guidelines are in the code books and then in the Appendix E for the textbook that you're using. Their chapter-specific guidelines exist for coding of certain parasitic infectious diseases. So looking at the coding guidelines for Chapter 1, these are the diseases you will be covering. HIV, we'll be talking about infectious agents, as the cause of diseases classified elsewhere. For instance, we're going to do urinary tract with E. coli. So the E. coli is causing a urinary tract infection. Infections that are resistant to antibiotics, sepsis, severe sepsis and septic shock, and then MRSA are some of the other conditions. And as you review through the PowerPoints, they're awesome because they go into great detail along with your coding manual stating exactly the same thing, just probably in a different spot where your PowerPoints are basically going to roll through. So they talk about HIV. If you have a patient that comes in with HIV, they're telling you to code only confirmed cases, selection and sequencing of HIV cases, and it goes down through to give you examples of that selection. So as you look at your coding manual, Chapter 1, you'll notice as we follow right along, HIV, code only confirmed cases, 2, selection and sequencing of HIV codes, patient admitted for HIV-related condition. Our next one is infectious agents as the cause of diseases classified to other chapters, and you'll hit the B95. Okay, so that also is right where it says B under Chapter 1, infectious agents as the cause of diseases. That is your guideline that applies there. Sepsis, we see a lot of sepsis in the facility where I work, that in an acute care facility. Bringing someone in, they may be in septic shock, or maybe they have a diagnosis that is leading up to a person going into having severe sepsis also. So we look at how to sequence that. We have MRSA, which is methicillin-resistant Staph aureus. They'll tell you how to code that. Again, I'm just going to go through some of these. This is the start of the chapter notes, and so you know where your chapter notes begin, obviously, and that is right at the very beginning of the codes. So we're looking right above the code A00, and you'll see exactly what is on the PowerPoint right in this coding manual. Includes use additional code to identify resistance to antimicrobial drugs, excludes 1, excludes 2, etc. So again, I will not be going through these PowerPoints verbatim, but just to give you an overview. So your health record information needed to code infectious and parasitic diseases, you need a body site, an organism, etiology, and severity, acute or chronic. There are combination codes, multiple coding also, and you will find that when you hit your index to the tabular. So alphabetical index identifies when required. And so you must always start with your index and then move to the tabular, and we'll go through that when we do our first diagnosis. They talk a little bit about sepsis, and if you are unsure of what sepsis is or septic shock, it's something that you should research. Google, Bing, however you research, pull that up and make sure that you understand exactly what it is so that you are only coding the diagnosis and not any part of that integral part of the disease then. And it tells you just a little bit. And it requires 2 codes again. So we're kind of breezing through this first time, but you'll know exactly what is there. And if you are like me, you will, I capture headlines a little bit. So I know that if I'm a beginning coder, I kind of try to think like a beginning coder. I'm thinking, hey, you know, I am coding out a patient with sepsis. I know that there's a guideline, so you'll go back and review those guidelines for that. Or maybe you remember something as we move through the PowerPoints or through the chapters in your textbook and your coding manual then. So again, HIV is a diagnosis that you could be coding. Maybe someone has asymptomatic HIV-related illness. Maybe they're just testing for HIV, and we do see that a lot in the clinics, not necessarily in the hospital. They're not going to be admitted for just a screening of that, but maybe they decide they're going to test them, and so you want to identify that they're being tested, that they were a high-risk patient for that. So then we look at the sequela of the infectious and parasitic diseases again. Bacterial and viral infectious agents will fall underneath this. Your alphabetical index entries will be infection. We have upper respiratory infection caused by adenovirus, again. Infection with a drug-resistant microorganisms, obviously we want to code that, and it can be coded 2 ways. We have coding and a combination code, and then it gives you actually the alphabetical index and how to find that. So this PowerPoint for our first chapter, chapter 1 in the coding manual, and you'll see it says chapter 4 in your PowerPoints, but it matches up to a textbook then. So, all right, they talk a little bit about methicillin MRSA again. We have treatment with antibiotics requiring a central venous catheter insertion or a PICC line. Again, there are codes, guidelines of how to code that also. We're getting into the PCS part of it, and I'm not going into that. That's a whole separate area, but as you'll see, even if you are just coding out diagnosis, if there is a procedure, you're also going to pick that up. Okay, so that was just a brief overview of the PowerPoints of the official guidelines that are in your coding manual. So let's take a look. We have Chapter 1, Certain Infectious and Parasitic Diseases, to the right of the screen. The patient comes in with urinary tract infection with E. coli. So let's code out the infection. Again, you've learned that you need to pick out your main terms. What we're seeing is that it is an infection. So we're going to go to our index, and we'll go to infection. Then we want to go to urinary, and take your time. Take a look at this coding manual. And where the columns are, make your way down through the columns. We see infection with drug-resistant organism, and you kind of make your way down through there. And you'll notice what we talked about in the PowerPoint does bring up some of these areas. We have due to or resulting from central venous catheter, device, etc. So let's stick to the plan, and we're actually looking for urinary tract. So we look at urinary tract and make your way down through the columns until you find the urinary. And you'll see that the code is urinary. Tract is in parentheses, which is a non-essential modifier, so it will not affect that code. And that code is actually N39.0. Underneath that, we see bladder, complicating kidney, urethra, but that does not pertain to what we're coding out. So we will look at the code N39.0. We'll make our way to the tabular and look for N39. Excuse me. So N39.0 tells us that it states urinary tract infection, site not specified. So you'll see it's a CC or the HG, and again, at the bottom of your coding manual gives all the definitions which you learned initially. At the front of the coding manual, they'll give you a legend that tells you exactly what the definition of those are. So if this patient came in and maybe they ended up with a CVA or a different diagnosis, this urinary tract infection could be a CC for that patient and they may end up staying longer. So let's go back. We have N39.0. Underneath it, it says use additional code from B95 to B97 to identify an infectious agent. We have an excludes note 1, candidiasis, neonatal, urinary tract such as cystitis, urethus. No, we did not have those diagnoses. And then we have an American Hospital Association guideline for 2018, second quarter, pages 21 and 22. So if you have an encoder, which I can bring that up here in a little bit, and we will look at that encoder also for that. So we back up. Those are the notes under the N39.0, but above that, this is your subcategory. Your category is N39. So you must always read your notes for the category, and it says other disorders of the urinary system. They're excludes notes, so if they had hematuria or recurrent persistent hematuria, you could actually code that out along with this urinary tract infection. You'll see a red check mark with 4th digit, so you have to use 4 digits. So the N39.0 is our code. Well, we're not done yet. So that is our category. So what we need to do now is look for the section. Where do these codes start? Are there more guidelines at the section? So right above the code N30, where it says cystitis, you'll see our section. That section is other diseases of the urinary system, N30 to N39. So our code was N39.0. Excludes urinary infection complicating abortion or pregnancy, and we did not have either of those diagnoses, so we are clear on that. Now, we need to go back to the beginning of the chapter. And so our chapter begins, we are actually in chapter 14 for this section, and it's chapter-specific guidelines with coding examples. Is there anything listed for urinary tract infection there? No, there is not. But we're not done coding out this case. So we've coded out N39.0. Now we have to pick up the E. coli. So let's go back to our index. And if you remember from the PowerPoint, you're going to go back to infection. And infection will tell you to see the site, see the infectious organism. And so that infectious organism is, and I spelled it out for you because we always just call it E. coli, but I believe it's pronounced Escherichia coli. So we're going to actually go to the E's and spell that out because that is where it will be underneath. Will be will be spelled out specifically. So we see the Escherichia coli as the cause of a disease classified elsewhere. In your index, we're under the Escherichia coli, and it says the code is, or it says E. coli in parentheses, the code will be B96.20. So let's hit B96, and we're going to be in our first chapter. So B96, excuse me, 0.20 states unspecified E. coli as a cause of diseases classifiable elsewhere. E. coli not otherwise specified. So we have a subclassification of B96.20. We read the B96.2, which is the category, and that is your full descriptor. E. coli as a cause of a disease classifiable elsewhere. It's telling you cannot use that. You must use B96.20, or you have the choice of 21, 22, 23, or 29. That is the beginning of that category. So now we read the notes. Now we need to go back to the beginning of the section. And you'll see that section right above the code B90. And it says, sequela, oops, I'm sorry, I went too far. It's right above the code B95. And it pertains to the codes B95 to B97, bacterial and viral infectious agents. Note, these categories are provided for use as supplementary or additional codes to identify the infectious agent in diseases classifiable elsewhere. And you have an AHA to 2018 first quarter, page 16 to review for that. So we look at that and we see that that is our notes, which we are using it as an additional code. So we're going to use the N39.0 and the B96.20. We're not done yet. So we're going to go back to the beginning of the chapter. And we're going to see if there are any notes that will pertain to this code or the codes that we have chosen. So the beginning of chapter 1, you need to review. And we're looking at, we start out with we'll just start with chapter 1, certain infectious and parasitic diseases. A is HIV, and then we're looking at B, and that is infectious agents as the cause of diseases classifiable to other chapters. As you read through that, you will notice that they bring up the B96, that it must be a code from this category must be used in order to identify the organism then. And that, an instructional note be found at the infection code advising that the additional organism is required then. So, as we code this out, you'll see in the purple box that there's this example that I am using. So our codes are N390, B96.20, explanation. An instructional note under the code for urinary tract infection indicates to code also the organism. And so you have coded that out. So your official guidelines are chapter 1, and it's B, infectious agents as the cause of diseases classifiable to other chapters then. Okay. That is chapter 1. So we're going to go into, your chapters again are a little different, so bear with me as I set up the PowerPoint for our next review. And we are going to hit neoplasms. Neoplasms are very, very, very in-depth. Something that when you get started with the neoplasms, I suggest that you maybe review the anatomy, the disease process, the pathophysiology of it, so you understand exactly what you are coding out then. Always use your index. If they're saying it's a carcinoma, adenocarcinoma, a tumor, always go to your index and follow through, as it will guide you to the correct code. And then we'll use our coding guidelines to code out the case correctly. So chapter 5. And we are looking at code C00 to D49. So again, understanding the coding of neoplasm requires particular attention to definitions and details. We'll go through just a quick review of that. We have malignant neoplasms, malignant neuroendocrine tumors, secondary tumors, malignant neoplasms ill-defined, of different sites. We have in situ neoplasms. We have benign neoplasms. Again, neuroendocrine tumors, neoplasms of uncertain behavior and unspecified behavior. And then they'll go through each one of these separately. So neoplasm behavior, refer to the definitions. What is malignant? Is it the primary site? Are they talking secondary? Carcinoma in situ. Is it benign, uncertain behavior, unspecified behavior again? So again, as you read through these PowerPoints, they are very, very directed towards the guidelines. So if I'm looking at a person coming in and the treatment is directed at the malignancy, there will be a guideline that specifically applies to that. So you should have Chapter 2 open. Back up here and get into our Chapter 2. So everything that we are discussing on the PowerPoint is listed in the Chapter 2 neoplasms, and you have at least 3 pages of guidelines of how to code out neoplasms. So it kind of tells you that it's a pretty particular chapter. And normally, when we hire a new coder, we don't start you right off on the neoplasms. That is a more in-depth chapter, so you'll be started on something that's a little less intense, that maybe doesn't have two or three codes, and that could take you 2 or 3 hours just to code something out, especially as a beginner. So your guidelines will apply to the treatment of the malignancy of the secondary site. Again, they're just telling you to be sure you refer to the guidelines, coding and sequencing, admissions, encounters for chemo, what is the extent of the malignancy, a review of the guidelines for symptoms, admission. Again, it's very, very in-depth. So as I always say, I'm just going to breeze through these as I talk a little bit here. When you get started with these coding neoplasms, it is very important that you understand how to use the coding manual also. So I'm at a PowerPoint right now where I'm just going to show you a neoplasm table. And that is at the very end of the index, Z of the index, you'll come to a neoplasm table. So open that up and take a look. And it will start with, you'll see that there are 7 columns at the top, 6 columns at the top of the page. Malignant primary, malignant secondary, carcinoma in situ, benign, uncertain, and unspecified behavior. Nice big paragraph for you to read before you ever get started. And this is the table that you will use. And it's not hard to use, really. It's not hard to use. You just have to know if they're coming in for primary. If the malignancy is primary, you'll stay in that column. If it was a secondary site, then you have your secondary column, and we make our way down through that. Okay, excuse me. So as you code out the different cases, again, it's something that your physician, we hope, is very specific. Maybe you are seeing a patient that has been treated 2 or 3 times, so you kind of have a track record. You know that they are being treated for breast cancer, it's malignant, and it's metastasized to the brain. So again, if they're still treating that primary site, you code that out as primary, then you move into the secondary, and vice versa. If they had malignant cancer of the breast 10 years ago and they come back in with headaches and pain, and they do the CAT scan and they determine that it has metastasized, that was perfect timing, hit that secondary site. Then if they have eradicated the primary and it's no longer there, then you could code a history, but the first code would be the metastatic code to that site then. So they give some great examples of that, secondary sites. Then they'll get into the different areas, malignant neoplasms of the hepatic system. Neoplasm-related pain, we do see quite a bit of that. As they come in, if that's the main thing they're coming in for, we're going to use a G89.3. So again, other conditions described as malignant, you need to understand that terminology, and then they get into the procedures for that. So obviously, I'm not going over that in depth as this is the diagnosis piece of it, but you obviously need to know exactly how those neoplasms are treated, radiation, chemotherapy, etc. So let's take a look at the example that I have chosen for you. We're looking at a patient who is a 72-year-old white female with a large, rapidly growing malignant tumor in the left breast extending from the upper outer quadrant into the axillary tail. So in the index, my thought process is I'm going to look for, I should say tumor, malignant, breast, it's left with a keyword, and then upper outer quadrant at axillary tail then. So where will I go to find that? Well, if you look at tumor, which we can in your index, take a quick peek at tumor. Tumor will tell you to see the neoplasm table. Or there's more, there are more than just that there, but tumor will say See also neoplasm, and then it gives you unspecified behavior by site. But don't sell yourself short. Always take your finger and go down through where the tumors are. As I think, as a beginning coder, you will, something may catch your eye. There are terms in here I've never heard of, and I sometimes it takes me a while because I research, oh, I wonder what Leidig cell means. So something that I've never heard of will maybe, pique my interest and make me take a look at that. So where you'll go with the tumor, it says see neoplasm table. So we are at the neoplasm table. It's a malignant tumor, so we already know that our column is going to be malignant. The next thing you will do is you need to read the note, because the note is actually going to give you a little bit more information. And what I'm going to tell you is that with this, if there are two sites listed and they're close by each other, you can code those out as contiguous sites. Okay, so you're not going to code them out separately. So we have an upper outer quadrant and an axillary tail. So you may have to research that, Google it, Bing it, find out exactly where that's at, what is the axillary tail, etc., before you can make that decision. But I made it for you. So we're going to go to breast. So find your breast. You'll see the neoplasm table. Breast, it says connective tissue, glandular tissue, and soft parts. And we are looking for specific sites. I see axillary tail. It says code C50.6. And then I see upper outer quadrant, C50.4. They're in the same section, you'll notice, 4 and 5. But what we have is an overlapping or contiguous lesion. So if you look right there under breast, you'll see overlapping lesion, and that will take you to C50.8. So let's go into our tabular and look at C50.8. And you'll notice what it tells you. There is a check mark there, so we must need another additional character, or characters are required. Okay, so C50, it states C50, and we said we could do the upper outer quadrant, but if you read your notes, they are two contiguous sites. That note told you that you could come to the overlapping sites of the breast. So we want to code out C50.8, and we are looking at C50.8 is malignant neoplasm of overlapping sites. C50.81 again states the same thing, and it says you need a 6th digit. So we see malignant neoplasm overlapping sites of the right female or the left, and they stated that it was the left. So we will code, the subclassification is C50.812. That is the code that we want. It is malignant neoplasm overlapping sites of the left breast. Now, let's move up to, it's up to our category, and our category is C50, malignant neoplasm of the breast. It says includes connective tissue, Paget's disease. Use additional code to identify an estrogen receptive status. Excludes skin of the breast, and then we have a coding clinic there that will help us out. Now, that malignant neoplasm of the breast, that covered just the C50 codes. Okay, let's make our way back to the beginning of the chapter. And our chapter reads, Chapter 2, Neoplasm, code C00 to D49, gives you specific coding guidelines. So we'll read the general guidelines, and then you'll start reading a primary malignant neoplasm that overlaps 2 or more contiguous next to each other should be classified to one subcategory 8. And that is what we did. So you'll notice right there in the purple box is the same example that I gave you. An explanation, this is because a single large tumor that overlaps 2 contiguous sites, a single code for overlapping sites is assigned. As a beginning coder, you would not know that. But as you start to code and learn those different official guidelines, that is something you will always remember, is that if it's of those 2 contiguous sites. So let's kind of look through this. chapter, it's a very in-depth chapter, as we started out saying. A is treatment directed at malignancy, treatment of the secondary site, coding of sequencing of complications. Again, tons and tons of information on neoplasms. So when you start to code out those neoplasms, the exercises, you've got to go back and use your coding guidelines. If you don't, you're basically guessing. Okay. All right, moving forward. Give me a moment here. Pull up my next PowerPoint. And we are going to be doing Chapter 3, which is Diseases of the Blood and Blood-Forming Organs. And I know the PowerPoint says 6, but that's for a textbook. So we're actually looking in your coding manual at Chapter 3. And what do we see when we first open up Chapter 3? We see that there are no guidelines for diseases of the blood and blood-forming organs and certain disorders involving the immune mechanism. D50 to D89 are codes. Chapter-specific coding guidelines and examples reserved for future guideline expansion. That's pretty cool. So I'm going to breeze through this PowerPoint a little bit just to cover the diagnosis that will be in the chapter. It kind of gives you an idea of what you're actually looking at. Whoops, sorry, back up here a little bit. So it contains codes for nutritional, hemolytic, aplastic, and acquired anemia, as well as the purpura, coagulation defects, and other disorders. This is your organization and structure of it. Kind of gives you an idea what you're looking at. Obviously, there is no guidelines in 2019. Instructional notes with certain anemia codes. Instruct the coder to use an additional E code to identify the cause if it's actually drug-induced then. So you'll have that. Use additional codes for adverse effects. Use additional code to identify associated conditions. And again, underneath in your chapter, when you pick out a code, those notes will be right there. So as you go to your code, you need to go back to your category, your section, and back to, well, the chapter, the beginning of the chapter, which, let's see, do we have any notes? Yes, we do. The beginning of the chapter, look above the code D50, and that is the beginning of your chapter notes. We have some excludes too. This chapter contains the following blocks, and then they start with nutritional anemias then. So again, we'll just kind of make our way down through this. Chapter 3, instructional notes, again, graft host, myelofibrosis, again, fibrosis, anemia. We talk quite a bit about anemia, if it's related to chemo, immunotherapy, radiation therapy, etc. They'll tell you how to sequence that. Management of anemia. Blood contains 3 main types of cells, obviously. I'll give you some review. How to determine that. Nutritional anemias. We do see a few anemias, obviously. Blood loss anemia is one of our the biggest one that we see. Okay, causes, other anemias, aplastic anemia, acute hemorrhagic anemia, again, due to volumes of blood loss. Thrombocytopenia, I do see several of that also. It's usually secondary to another disease, so I code those out quite frequently. Again, intraoperative and post-procedural complications of a spleen. Again, I like these little notes. These are really not new, but it does help. I work on a surgery floor, and so I see a lot of the intraoperative post-procedural complications that will keep a patient in the hospital. So it's nice to know that we have some guidelines that pertain to that. Then we'll get into the procedure coding, and they just begin the root operations, and we'll review through that. And I do not cover that, and that's the end of that PowerPoint. So I did pick out one diagnosis for us, even though there are no guidelines, but I said we have a 32-year-old who has iron deficiency anemia. So again, your index would be anemia. You're going to look at iron deficiency, and let's just do that real quick. Excuse me. And we find anemia, and it has right away essential, general, hemoglobin deficiency, infantile, primary, profound, D64.9. I'm going to see if I can be more specific and see if I can't come across iron deficiency. So take a moment, take your finger, and see if you can't find iron deficiency. You should be able to locate that. And it says iron deficiency code D50.9. Again. And then you have other secondary to blood loss. They don't say that, and it's not specified site. So we'll leave it as unspecified. So we have D50.9. Get into your Chapter 3, Diseases of the Blood and Blood-Forming Organs, and look at D50.9. Iron deficiency anemia unspecified. Subclassification. The category is D50, iron deficiency. 1 includes note, and it tells you you need that 4th digit, so we have to code it out as D50.9. And then above that, your section is nutritional anemias, D50 to D53, definition and a tip, actually. And then above that, it says Chapter 3, and it gives you an excludes note, and then this chapter contains the following blocks. And then there are no guidelines. All right, that was a pretty easy chapter. One more to go. Bear with me. Oh, maybe. Where'd my chapter 5, 7? Here we go. Okay. And we are going to hit Chapter 7, which is endocrine, nutritional, and metabolic diseases and immunity disorders. Our codes are from E00 to E89. Let's just talk a little bit about this chapter and open up your coding manual to the Chapter 4. Excuse me. Let's see what diagnosis we can cover here. So at the conclusion of the PowerPoint, you should learn a little bit about the coding of endocrine, nutritional, metabolic diseases, and immunity disorders then. Whoops, sorry, breeze through that a little bit quickly. So we're looking at, this includes common disorders of a thyroid gland, obesity, dehydration, and diabetes, all of the things I code daily. Other conditions, we have intraoperative post-procedure. Diabetes is huge. It's combination codes. Notes will appear under all diabetes categories, so be sure that you're reading those. Diabetes mellitus due to an underlying condition. It's telling you to code first that underlying condition then. Was it drug or chemical induced? We have a lot of thyroid gland, hypothyroidism diagnosis. Our diabetes mellitus, again, if you look at that category or your guidelines, it covers almost all the diabetes. So it tells a little bit about diabetes. And if you know someone that has that, you're probably very familiar with it, type 1, type 2. And those are important things to know. So diabetes due to an underlying condition, obviously. Code first, read your notes. Make sure that you are reading through those. Coding overview for diabetes, again, is needed to identify all the associated conditions that a patient may have. So additional code is available to indicate the use of insulin, except with type 1. So again, they want to know, are they taking insulin? Some of the disorders you will see of the endocrine glands, there are guidelines that will cover that. Malnutrition, again, is underneath this. Overweight, obesity, hyperelimination. Again, we do cover that and code that out now on every chart. If their BMI is over a certain, the physician is documenting that as it is affecting their health. So we are picking that up on patients that have a BMI, again, that is over, considered to be obesity. Again, post-procedural endocrine and metabolic complications, some things that I will see, maybe something is causing that. And then we get into the procedures for the endocrine, nutritional, and metabolic. And again, this is the procedure section. So Obviously, if you've gone through that class, you're looking at common procedures, excision, resection, biopsies, and they give a little bit of information in regards to that. So our last diagnosis, patient diagnosis I have is a 45-year-old patient is diagnosed with type 1 diabetes. So in our index, we're going to hit diabetes mellitus. You can hear me. I'm just going to follow right along with you and not just give you the page number, but we're looking at diabetes, and you'll see diabetic. It says mellitus, sugar E11.9. So we know that it is a type, it is type 1. So take your finger and make your way down through the columns to see if you can be specific just through the index. Index is an awesome place to start. And do your best to always review through everything, all the columns underneath when you first start as a coder. As I stated previously, I think that there are things that will stick in your mind or that you will catch and you can go back and refer to. So I do see that we can code out diabetes type 1, E10.9, and then you look underneath that it says with other diagnosis. Well, I have nothing else listed there. So we're going to go with the E10.9, and we'll go back to our chapter. And some of you may want to start with the chapter guidelines, and you can sure start there. I backtrack when I code, and I just always have, because I used the book for 20 years, and then we went to the electronic version, obviously. So it's just something that I got in the habit of doing. So E10.9, we're looking at type 1 diabetes mellitus without complications. We're going to go back up to the beginning of that category. Turn our page back here a little bit, and we start with E10, type 1 diabetes mellitus. So that's our fourth digit. It's requiring a fourth digit, which we have if we code out E10.9. Underneath the E10, it says includes brittle diabetes, the diabetes mellitus, idiopathic, juvenile, ketosis prone, and then it excludes the following. So if they happen to have hyperglycemia, not otherwise specified, it's excluding that, and you could pick that code up, okay? And we're not mentioning that. We have some of the AHA coding clinics that will help with that also. So that is the beginning of that category. Now we want to go back to the beginning of the section to see if there are any other notes. And that takes you to right above the code E08. You'll see the beginning of the section for those codes. Diabetes mellitus for E08 to E13. There are no notes except for a coding clinic. If you have an encoder or something you can pull up, you'd be able to view that in the resource section of the encoder, and it will bring up that information then. So we have to go back to the beginning of our chapter, which is chapter 4. Right above the code E00, you will see the note, all neoplasms it talks about, excludes 1. We have an AHA coding clinic, and then this chapter contains the following blocks. Those are the notes for that particular E10.9. Now, do I want to know a little bit more about are there guidelines for diabetes mellitus type 1? What I would have to do is review back through and just look at the codes. In some of your coding books, the nicer coding manuals will actually tell you where to go. Under E10.9, it will tell you to go to Chapter 4, look at A and then 1, and it will say, type of diabetes. And type 1, diabetes mellitus without complications. And our code is E10.9. And that's where I took that, was that the little purple box right there. So again, it just tells you a little bit more definition of that too. So if you have an Optum, it's called a expert, I believe it is, then those guidelines could be right underneath there, and then you can go right back to that. Otherwise, with this professional edition, if you're using that, you will have to go back to the beginning of the guidelines. So, and I put the guideline there, Chapter 4A2, and it's type of diabetes. So that concludes my review of these chapters for the week, for your weekly lecture. And we reviewed Chapter 1, Chapter 2, Chapter 3, and Chapter 4 of the coding manual, and did just a quick overview of the PowerPoints that pertain to the guidelines, and then we coded out 4 different exercises. Thank you for joining me. Have a great week.